Osman. Dr. Osman.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم ورحمة الله وبركاته. Inshallah, over the next 45 minutes, 1 hour, we'll be going through the lecture, Cancer Management, Causes and Preventions. So these are the outlines of the lecture. But basically, before we start checking through the outlines, from the basics, I want us to know what cancer is. Cancer is a broad term that is used to describe a group of diseases. Let me take us back to biology class. No, they used to tell us that cells, they are basic units of living things, the simplest units of living things. So that is the definition of cells we were taught in biology class. So these cells, it means that any activities a human being is doing are functions of cells. So these cells, the group of cells, make tissues. From tissues, we have organs. From organs, systems. So it is these systems that functions in our day-to-day activities. When we talk about respiratory system, digestive system, excretory system, so these systems combine together to make human being, because all these activities are being controlled by the nervous system, the neurology, that is the brain. So basically, all these functions are referred back to cells. So the basic thing is the cells. So these activities are majorly originates from the cells. So the body has programmed these cells to undergo some process that we call cell divisions. But all these cell divisions, they are still under the control of the body. That's okay. A particular group of cells should divide 100 times before they can form a tissue. So in cancer, these cells are supposed to multiply, as I said, they are supposed to divide. So when they divide, they form tissues. Then the tissues also group up to form organs, then systems, and so on. So basically, these cell divisions, they are under the control of the body. The body has control over them. That's okay. These particular tissues should divide 100 times. But in cancer, they don't listen to the body again. Instead of 100, they will divide 1 million times, 1 billion. It can be up to that. So this is cancer. So basically, it is a group of disease in which there is proliferation. Proliferation means division. There is aggressive division of cells that is no more under the control of the body. So reproduction. Cancer has become a major source of morbidity and mortality globally. Morbidity means sickness. Mortality means death. So it has become a major source of sickness and death globally. Quite unfortunate. Decades back, we don't have more cancers in Africa, in developing countries. But it's quite unfortunate now that since the advent of technology here too, we tend to inherit them inherit so many things from them. The commercialization, the food we eat, even our day-to-day activities. We look at them before we do things now. So, and unfortunately, we have to inherit their disease too. So it has become a major source of morbidity and mortality globally. And everybody else should be aware that there are so many personalities in this country that have died of cancer. It's Umaru Musa Yadaw, he died of lung cancer. There is this, for those of us that listen to music, there is this guy that died recently, San Sultan. So he died of throat cancer. It's called hematoblastic lymphoma. So many personalities have died of cancer. You know, but we know this because they are personalities, they are the ones we know. So there are so many people that are dying of cancer every day. If you go to our hospitals, we see them bedridden in the hospital. So it's quite unfortunate. And it's now assuming increasing importance in both developed and developing countries, as I just said. Then there is an epidemiological transition from communicable diseases to predominantly non-communicable diseases in Nigeria. Epidemiology basically means the study of occurrence of disease. So then, back then, we used to have cholera, typhoid, malaria, but now we are having diabetes mellitus, hypertension, cancer, chronic kidney disease, which is quite unfortunate. So cancers are increasingly becoming an important contributor to the national disease burden and therefore a major public health concern. So it is now a concern for the public health. So from the definition, the disease that results when cellular changes cause uncontrolled growth and division of cells. As I said earlier, they don't listen to the body again, so they are not under control. They just keep on dividing. Some types of cancer cause rapid cell growth, while others cause cells to grow and divide at a slower rate. Of course, yes, there are some cancers that, from the incidence of the disease to the end of the cancer, that is when it claims the patient's life, just be like 3, 4, 6 months, like cancer of the stomach, gastric CA, pancreatic CA. That pancreatic CA killed one man in Edo State recently, philanthropist. I've forgotten the name. He died of pancreatic CA. So very unfortunate. Certain forms of cancer result in visible growths called tumors. Tumors basically mean swelling. So like breast CA, if you see a patient with breast CA, you see the swelling. You see that the breast will be enlarged. While others such as leukemia and prostate CA do not. So we don't see leukemia. Leukemia is cancer of the blood. Then prostate CA, that is the commonest CA in men. The commonest CA in men. Prostate CA. We'll still talk about it later. So it's quite unfortunate that we don't have reliable data in this part of the world. So our data record is very, very poor. So we can't say that at this particular time, this is the number of cancer deaths we have. But I'm telling you, we have so many cases of cancer. When you go to the teaching hospitals, the tertiary institutions especially, because unfortunately our people here, they present very late when there is very little or no thing that the doctor can do. So, but generally, the incidence, the occurrence of cancer, it increases with age. As you get old, so it means there is a chance for us to have cancer. Then it is also commoner in men than women. Generally, if you look overall, it's commoner in men than women. So why the need for this lecture? Why do we need to know about cancer? To keep us abreast of possible risk factors for cancers. There are so many things we do nowadays, knowingly or unknowingly, that are responsible for cancers. Those are the risk factors. We need to know about that. So when we prevent that, it reduces our chance of having cancer. Then also to promote and develop awareness in the public and emphasize the importance of early detection. There is this saying that the best treatment of cancer is prevention. Let's just prevent it. The next best treatment after prevention is early detection. Once we see the signs, we should just make sure we present to the hospital so that it will be treated. Once we present early, 99.9% of cancers are treatable once we present to the hospital early. So to assist and encourage people in making healthier lifestyle choices. So when we know the things we do that can predispose us to cancer, I think everybody here would want to avoid it because of how deadly the disease is. This pathophysiology, they are English, they are medical words. I can't find a simpler means of actually putting this up. But basically, what I just want us to understand is pathophysiology means how the disease affects body system in a wrong way. Pathology is disease, physiology is normal body functions. So as I said, when these cells multiply, when they divide above normal, instead of 100 cells, we are having 1 billion cells. Then there's something in the body we call metabolism. Metabolism, they are the function of any activities we do in the body. So we now go back to ATP's formation, energy formation. Now, basically, as we breathe in oxygen, we breathe out carbon dioxide. So as we breathe in the oxygen goes straight to the lungs. At the lungs, the oxygen is mixes with the blood. So we have the oxygenated blood. Then the CO2 gets excreted from the lung. So it is this oxygen that is being transported by the heart throughout the body to the cells, from arteries to arterioles to the cellular level. So at cellular level, that's where we need the oxygen. As I said earlier, everything is at cellular level. So when this oxygen gets to the cell, respiration takes place. So after the respiration, ATPs are formed. These ATPs are basically the energy we need to do our day-to-day activities. So the units of oxygen that is supposed to supply 100 cells. Now there is cancer, there is 1 billion cells. So how do you want it to be enough for this 1 billion cells? So that is where the problem starts. Basically, that's where the problem starts. So that's where we have cachexia. Cachexia basically means loss of weight. We have metastasis, a very bad attribute of cancer. A person will have cancer in the stomach. The second day, you hear that it's having respiratory difficulties. So that the cancer has jumped. That is the normal lay language I can use. It has jumped from the stomach to the lungs. So the patient cannot breathe well again. And it's not that it leaves that stomach, it's still in the stomach. We still feel the effect in the lung. So when now, if you now do tests, you do biopsy, you see that cancer has gotten to the lung too. You see it in the brain, metastasized to the brain, all over the body. A very bad attribute of cancer. But mostly this happens at complicated stage, when complications start setting in. So this is the summary of all this pathophysiology I just explained. So majority of the disease are attributable to a few risk factors, which are either independent or in combination. As I said earlier, majority of the cancers, there are risk factors that cause them, which are avoidable in our day-to-day activities. So of the 7 million cancer deaths worldwide in 2001, an estimated 2.43 million, which is about 35%, were attributed to 9 potentially modifiable behavioral and environmental factors. What this basically means is that 35% of the cancers at 2011 were linked to what we do and the environment we stay. That's okay, we do this thing, we eat this kind of food, we stay here. So this is what causes cancer. And they are modifiable. It means it's something we can control. So the symptoms of cancer, basically symptoms of cancer depends on the types of cancer. So it depends on where the cancer is. But the general symptoms are weight loss, unexplained weight loss. Not that you never chop for 1 month. You are eating well, but you note that you are losing weight. You should suspect cancer. There is this rule in medicine that anybody above the age of 40 with unexplained weight loss, you think of cancer first before any other thing. Cancer. After 40 years, present in the hospital, or you are at home, you are eating well, but you notice that you are losing weight. Cancer before any other thing. Anemia means blood, the reduction in blood level. As I said, so many cells are available to a very little amount of blood. So they chop the blood. The available blood is not enough for the body to use. Tumor, as I said earlier, it means swelling. There is another rule in medicine that any tumor, any body swelling, anywhere in the body, after the age of 40, anybody above 40 years, then you just see unnecessary swelling in any part of the body. Think of cancer before any other thing. So these are the types of cancer. Cancer can occur in any part of the body. Mention it, any part of the body. The skin, the nails, blood, any part of the body. You can have cancer there. So as you can see, these are for the males, and these are for the females. So there is throat cancer, cancer of the throat. That was the one that kills and suffer. There is cancer of the esophagus, lung cancer, there is stomach cancer, bowel cancer. Bowel cancer, there is cancer of the bladder, prostate cancer. As I said, the commonest cancer in men, that is prostate cancer. I'll talk about it now. We have testicular cancer and skin cancer. Prostate cancer is the commonest cancer in men, as I said. There is an organ in the body we call prostate. That organ, it surrounds the urethra. There is somewhere around this part of the body. There is somewhere around this place. So we have urinary bladder here. In every man's body, urinary bladder. So there is urethra. It is the urethra that connects the urinary bladder to the exterior, and that's where we pee. So which means inside the penis, at the interior part of the penis, it is the urethra that conveys the urine outside. So just after the urethra leaves the urinary bladder is where we store the urine. So when it is filled, we feel the urge that we want to urinate. So immediately the urethra connects the urinary bladder. That's where the prostate is. It surrounds the urethra like this. And what are the functions? It secretes some secretions that helps in nourishing the sperm cells and also helps in transporting the sperm cells. So that liquid we see whenever we ejaculate is called semen. So which means the combination of sperm cells and other secretions. And usually these secretions are from the prostate. So that's what it does. So it gives secretions that helps to transport the sperm and also to nourish the sperm so that the sperm won't die immediately after it is produced. So that's the function of the prostate. And unfortunately, it is the commonest cancer in men, as I've been saying. Commonest cancer in men. What are the risk factors? Okay, let me talk about the symptoms first. What are the symptoms? Most of the times, it is asymptomatic. You won't feel any symptoms at times. Most of the times, you won't feel any symptoms. It will cause like that. But the other symptoms of prostate cancer, there is this thing we call urinary symptoms. Frequency. You'll be going to pee every time, like 20 times in a day, 50 times in a day. You think of prostate cancer. Urgency. If you are feeling the urge to urinate, you can't just hold it. You can't hold it. If you try to hold it, the thing will come out. It's a symptom. There is nocturia. You will be waking up at night. Dysuria. You'll be feeling pain whenever you want to urinate. Hesitancy. Always having the urge to urinate. Dribbling, terminal dribbling. After you've urinated, you still feel that something still remains inside me that is not yet out. So these are the symptoms of prostate cancer. These are the things we feel whenever there is prostate cancer. Plus the general symptoms I mentioned earlier, the weight loss, the anemia. Weight loss. It's a general symptom of all cancer. All cancer causes weight loss. So let's bear that in mind. So these are the symptoms of cancer. Then also low back pain. Whenever we're having low back pain, that cancer has metastatized to the vertebrae, to the lumbar vertebrae, and that is not a very good sign. So these are the symptoms of prostate cancer. So the risk factors for prostate cancer. What are the things that cause prostate cancer? Number one is the age. Yes, it is commoner as we grow old, especially above the age of 50. 50 plus, that's when we see most prostate cancer. That's when the incidence are more. Then also, there is these chemicals in the herbs, in the herbicides. So whenever we try to kill our weeds in the farm, all these herbicides we buy around. So after spraying it to the weeds, rainfall, when rain falls off, it washes it to the water body. When it washes it to the water body, the fish lives inside the water. This particular chemical, they are gotten stored inside the fat of the fish. And the human being catch fish and we eat fish. So this is part of the risk factor. Yes, the chemicals in the herbs, in the herbicides. It is part of the risk factors for prostate cancer. Also, obesity. Obesity. So when we talk about obesity, objectively, we need to talk about another term we call BMI. BMI means basal metabolic index. That is when we can know if a person is obese or not. It's not the guy is short and the guy has tummy. No, we can't be so sure that the person is obese. I'll quickly tell us how to do that now. Our weights. If we measure our weights now, our weights in kilogram. Like take for instance, my weight is 70 kg, and my height is 1.5 meters. So to know the BMI, I'll now say that 70 all over my height, which is 1.5 meters, all over 1.5 squared in meters, not centimeters. So the value it gives me, that is my BMI, whatever value it gives. We should note that from 19.9 to 24.9, that is the normal value. If we fall between that value, we are very okay. 19.9 to 24.9. After we divide our weights in kg with our height in meter squared, the value it gives us, if it falls between 19.9 to 24.9, perfectly okay. If it falls between 25 to 29.9, that's what we call overweight. Overweight is not fine, it's not good. We encourage that person to do exercise so as to come back to normal. So if it falls between 29.9 to 34.5, that is obesity. We call that one mild obesity. From 35 to 39.9, that is moderate obesity. And anything after 39.9 is morbid obesity. Morbid obesity means obesity that will definitely cause sickness. It will definitely cause sickness. So why am I telling us this? Anything at the range of obese level, that is, if our BMI is more than 29.5, it's a problem. Yes, obesity causes all forms of disease. In fact, obesity is implicated in every form of cancer. Any form of cancer, you will mention that word obesity. Then diabetes mellitus, chronic kidney disease, hypertension, just mention all these chronic diseases. Obesity is always implicated. So we should know that. We should check our BMI. If it falls out of this level, we should find a way of reducing our weight. I'll tell us some before the end of the lecture. So these are the risk factors for prostate cancer. The treatments, I'll talk about the treatments later. The next common cancer after prostate cancer in men is colorectal CA. Colorectal CA. And the meaning of that is where that's bowel cancer. It also means colorectal cancer. And the meaning of colorectal cancer just means cancer of the large intestine. In our biology, small intestine, like we have a stomach, small intestine, large intestine. So any cancer that occurs in large intestine, that is the colorectal seal, colon and the rectum. So that is the commonest cancer after prostate cancer in men. And what are the symptoms of this colorectal seal? Weight loss, as I said earlier, implicated in all forms of cancer. Then also, there is a medical term we call tenesmus. Tenesmus just means that you are feeling urge to defecate. Yes, you are feeling that, yes, this shit is almost air. But you get to the toilet, the shit is not coming out. If you're having that, that is colorectal CA. No, just don't think of any other thing. CA straight, colorectal carcinoma. Like you get to the toilet, the sheets don't reach this level and it's not just coming out. That is colorectal CA. Then some people will also be defecating blood. Blood will be coming out from the anus. That is another symptoms of colorectal CA. Abdominal pain. Yes, you will be feeling the abdominal pain. Yes, the abdomen will be paining the particular person. So these are the symptoms of colorectal carcinoma. And what are the risk factors? What are the things we do that causes it? I'll talk about the risk factors generally at the end of this slide. So I'm just bringing this. So majorly, the major risk factor here in colorectal CA, we talk about number one, we talk about the age too. Yes. When we grow older, there's tendency to have this colorectal CA. Then aside that, there is genetic predisposition. What do I mean by that? It can be inheritable. Like there are some mutated genes that we can inherit from either of our parents, so that they can pass on to us that can cause this cancer. I'll still talk about them generally later. Then also, after that, we have lung cancer. That is the next commonest cancer in men. So this lung cancer, the commonest risk factor for lung CA is smoking, tobacco smoking. Either you are smoking it, you are eating it, anything in form of tobacco you are using. That is rising letter to lung cancer. Then even this normal cigarettes, there is this substance there, nitrosamines. That one is carcinogenic. It causes cancer straight. It causes cancer straight. So these are implicated in lung cancer. There is also genetic predisposition also in this lung cancer. That is, if there is any family relative that has lung cancer, there is a chance of you having this lung cancer. What are the symptoms? The symptoms: weight loss, number one; breathlessness, that is difficulty in breathing; cough that refuses to go. You are coughing, you go to the hospital, they give you antibiotics, everything. The cough no gree go. So we talk about we should think about this lung cancer. Hemoptysis, coughing and spitting out blood while coughing. That is hemoptysis. So these are the symptoms of lung cancer. I think these are the three commonest cancers. Also, I want us to talk about. Then also, I want to talk about this breast cancer. So we don't have our women here, but it's very, very important. Most of us here are married. So this breast CA is very, very important. It is the commonest cancer in women. Very, very common. Very, very common. So what are the symptoms? There is something we call lump. Lump is like if you put a stone inside something and you are feeling that hard feeling, that is lump. And that is why we as married men, we need to know about this. So in most cases, it is the husband that discovered this lump. It is the husband that discovered this lump. So this lump, when you feel this lump, and the lump is hard, and it is fixed, you cannot move it anyhow. So that is breast CA. That's breast seal. That is the first thing we do, the lump. Then also this lump now starts to get bigger. To start to get bigger, it can be as big as anything, to any level, it starts to get bigger. Then after that, there is dimples along the skin. Dimples, you'll be seeing like holes along the skin. Then there is weight loss. Then blood can be coming out from the nipples of the woman. So these are the symptoms of breast CA. So what are the risk factors for breast CA? Number one is genetic predisposition. If there is anyone that's there's breast CA in man too, in men too. There's breast CA. Men do have breast cancer too. Just that whenever a man has a breast cancer, they hardly survive. It is very, very malignant. Men do have to, but it is the commonest cancer in women, as I said. So, genetic predisposition. So, if we have a family member with breast cancer, the doctor, especially the first degree relative are the siblings. So, it is a high risk factor for breast cancer for this person. Then also there is the foods we eat, all these fatty foods, all this. I will still talk about them later, so that's why I'm not talking about all this now. So they are also the predisposing factor for breast cancer. Then another thing is nulliparity. Nulliparity means when a person has not given birth. That is nulliparity. So if you are delaying your marriage, you want to marry at the age of 45, you have a high risk of having breast cancer. Then also, the more you reproduce, the more you give birth to children, the lesser risk of having breast cancer. Then also oral contraceptives. All these ladies that after they don't do what they are not supposed to do, they use all sorts of drugs to bring down the pregnancy. That's what we call oral contraceptives. It's different from family planning. Family planning is not indicated in breast cancer. But the oral contraceptive, the one you take, you put in the mouth to bring down this pregnancy, it's a risk factor for breast cancer. So there is something we should know here, that there is this screen, as I said earlier, that all forms of cancer, if there is early presentation, they are curable. So there is this screening we call mammography. It is advised. It's because of our health status in this country. Anybody at the age of 40 above should be doing it every year. This mammography is like scan or like X-ray radiation. They will just scan the breast. Even this lump, before it becomes palpable, before we can touch, the mammogram will pick it. So once it picks it, they are telling us that there is breast cancer. And if you can present early to the hospital, it will be curable. Just mastectomy, cut away the breast, and the person is okay for the rest of his or her life. The wife of Ondo State Governor. So it's an open witness. It's a breast cancer survivor. Some signals of cancer, some signals of cancers. All these things I mentioned, any sore that does not heal. Sore means wound. So if you are nursing a wound and the wound refuses to heal, despite antibiotics and good wound dressing, it's telling us that yes, this thing is telling us this is cancer of the skin. Cancer of the skin. Lump or thickening in breast or elsewhere, as I said, tumor, swelling anywhere. Think of cancer, especially after the age of 40. Unusual bleeding or discharge. Bleeding from the anus, from the mouth, from the nose, nasopharyngeal carcinoma. Think of cancer. Any change in mole or swelling, that is attributable to the skin. Mole is all this black thing that used to be in the body. Many people do have it, all this black. So that's the mole. So if it is changing, like it's just getting bigger, think of cancer. Persistence, hoarseness, or cough. Hoarseness means when the voice begins to deepens, like, and that's what refused to come. It is persisting. Think of lung cancer. Persistent indigestion or difficulty in passing stool. So this one is talking about the cancer of the large intestine, colorectal carcinoma. Then change in bowel habits. Like, okay, this is someone that's used to go to toilets every day, but you just find it, yes, the symptoms of the colorectal carcinoma, those that I forgot, you just see that in 1 week, you are not going to the toilet. You are not peeing in 1 week. In 1 week, you are not going to the toilet. You think of colorectal carcinoma, then instead of shit to come out, you're having mucoid-like something coming out, apart from the blood, like mucus, something like catarrh, that thing that comes out. So you think of colorectal CA. Then also chronic pain. Chronic pain means pain that refuses to go. Despite treatment, you are just having this pain persistently. You should think of carcinoma. So these are the signals, early signals of cancer. So, and as I said earlier, prostate cancer, colorectal cancer, liver cancer. So this is how they are common in men. And in female, breast CA, cervix CA, cervical cancer, is the next commonest cancer after breast cancer in women. I will quickly talk about that because of two things. It is very, very common, and majorly the organism implicated is a virus. They call it human papilloma virus, which is contacted through sex. Either you protect yourself or you don't protect yourself. HPV doesn't know that. So you use condom, you don't use condom, it will be transmitted to the woman. Once it is transmitted, there is high risk of the woman having cervical cancer. In fact, any woman with cervical cancer, we talk about human papilloma virus. These factors, but before these risk factors, there is something I want to talk about before I forget: liver carcinoma. There is this thing that causes that is now very common, that is causing liver cancer, and this is hepatitis B virus. Hepatitis B virus. It is deadlier than HIV. Very, very, very deadlier than HIV. It is actually another topic for another day, but I'll just browse through it. Hepatitis B, anybody with hepatitis B, it can be of two infections. I'm digressing because of its importance. You can have acute hepatitis or chronic hepatitis. Once they screen you and they tell you that, oh, you have hepatitis, after 6 months, you go back to check. If that hepatitis is still there after 6 months, that is chronic hepatitis. And that is the one that causes liver cancer. I need to talk about it because whenever it causes cancer, there is no cure. There is no cure. Liver cirrhosis, liver cancer, there is no cure. The cure is liver transplants. And we don't do liver transplants in this country. And even in the overseas where they do it, the chances of survival are very slim. So it is this hepatitis B that causes liver carcinoma. And mostly for hepatitis B is a virus that a normal human being will fight and it will go off. It will go if you have a good immune system. But 99.9% of adults with chronic hepatitis B, they've been infected since childhood, since when they are small, since immediately they born them. Because at that time, their immune system is still very low. So they don't have good immunity to fight diseases. So in this regard, they have this virus, and the virus will be part of them. For now, there is no known treatment of chronic hepatitis B. That you have chronic hepatitis B, and you treat it and it will go. No, it will be there. So you can just be managing it. You see, gastroenterologists, they will be giving you drug that will bring it to 0 level, but that virus is still there. So as at today, there is no known cure. So this chronic hepatitis B virus, it causes liver carcinoma. So risk factors or causes: overweight and obesity. I've explained that. Obesity, overweight, normal weight. I've explained that. Low fruits and vegetables intake. If you don't take fruits and vegetables very well from study, you tend to have cancer, not even only cancer, all other forms of disease. If you go and see a cardiologist, cardiologist that is specialist in that takes care of hypertension, they will tell you that you should increase your vegetables and fruits intake. So generally, fruits and vegetables intake, they are very important because these things, they contain antioxidants that helps body, and they are also fibers. Physical inactivity, like especially those that live sedentary lifestyle, you sit down in one place from morning till night. So that will tend you to be obese, to be growing weight unnecessarily. So this predisposes to cancer. Tobacco use, I mentioned it earlier. Alcohol misuse. When you take alcohol, you have cancer. When you take alcohol, because the liver processes the alcohol. We have from alcohol, we have there is this thing the liver processes into that is carcinogenic. I've forgotten it. So alcohol is majorly indicated. It is much indicated in colorectal CA and in prostate cancer, the commonest one in men. Then urban air pollution, all this pollution around, the exhaust from cars, from companies, unsafe sex in human papillomavirus, indoor smoke from household use of solid fuels, and contaminated injections in healthcare settings. This one causes a form of skin cancer. Cancer-causing agents, so it can be occupational hazards. It consists of about 5% of causes of cancer. Scrotal CA in chimney sweepers. Chimney is this the tubes they use in big company for the exhaust to go away. So those that sweep this chimney, they are predisposed to scrotal CA because of the soot in this chimney. Urinary bladder CA in chemical industrial workers. There is this common thing about this urinary bladder CA too. Those that swims in untreated water, there is this organism, Schistosoma hematobium. So that one is indicated in cancer of the urinary bladder. Remember, the urinary bladder is where we store the urine, where the body stores the urine. Mesothelioma in asbestos workers. Yes, I forgot to mention it. Mesothelioma is a form of cancer. It's a form of cancer of the lungs. So those that works in asbestos company, they tend to have this mesothelioma, this lung cancer. Skin cancers in workers in contact with ionizing radiation, radium and X-rays. Ionizing radiation from X-rays, people that works in X-ray department in the hospital, people that stays close to all these telecommunications masts, the MTN masts. So radiation comes from this place. Radium, this basically is from the miners, the geologists, in the extraction of uranium and X-rays. So all these are implicated in skin cancers and so many forms of cancers. The myeloid leukemia in rubber industry due to exposure to benzene. Benzene has also been indicated in causing leukemia, which is cancer of the blood. Other carcinogens include electricity in appliances or transmission lines. All these big power lines that emit electricity. So if you work with PHCN, you should be careful. Abu Muhammad. So diesel exhaust from our gen, the gen that uses diesel, sun lamps and ultraviolet radiation. So from studies, this substance, formaldehyde, is a substance that is probably causes cancer. Formaldehyde is this formalin that they use to preserve dead bodies in the morgue. Then the possibly carcinogenic, yes, it has not been well established, but yes, there is possibility that this causes cancer. Coffee, styrene, gasoline engine exhaust, welding fumes, and electromagnetic fluid. But not X-ray. X-ray has been established anyway. So the proven carcinogens, they are the gamma radiation, asbestos, mustard gas, and tobacco. As I mentioned, tobacco, very, very important. It causes cancer a lot. Chronic irritation, e.g. chronic wound. As I said, if there is a wound that refuses to heal and you are not diabetic, think of cancer. Junctional and compact nerve melanoma. Melanoma are the cancers of the skin, but it occurs majorly in the albinos. Then bone scar, Meijolein ulcer, in squamous cell carcinoma. Also, carcinoma of the skin. If there is a very severe burn injury, it can cause cancer of the skin. The liver cancer. So, aflatoxin B1 from Aspergillus fungi in the poorly stored wet food in mid areas as found in tropical areas. It's poor and so aflatoxins are majorly they are formed when we store our food poorly. When the foods are not well stored, when the food starts to be getting spoiled, we have all these aflatoxins. So they are indicated in cancer of the liver. Mold contaminated foods. If you buy bread and you left the bread for weeks, for days, that thing that grows in the bread, that is mold. It is carcinogenic. It can cause cancer. Nitrosamines from ingested nitrates, basically from cigarettes. Nitrosamines is there, so that's one causes lung cancer. Either smoking or chewing tobacco, as I said earlier. Alcohol, especially beer, in association with rectal carcinoma, colorectal carcinoma, cancer of the large intestine that I talked about, the second commonest cancer. So, infective agents and viruses that cause cancer. Schistosoma hematobium, I mentioned that earlier, in bladder CA. Clonochis sinensis, it can cause liver carcinoma. This one is found in fresh water. So this organism is found in water. It's found in fresh water. So the freshwater fishes, if you eat them without boiling them well, without cooking them well, it gives rise to cancer. Hepatitis B virus, as I mentioned earlier, Epstein-Barr virus, there is this other virus that is called Epstein-Barr virus. It's implicated in the African Burkitt's lymphoma. Burkitt's lymphoma, they are cancers of childhood, of small children. They will have this place will be enlarged. So Epstein-Barr virus and malaria. So this ordinary malaria fever can cause cancer. Epstein-Barr virus and malaria. Burkitt's lymphoma, they are cancer of the children at the age of 5 to 15 years. You see it, they have abdominal swelling, weight loss. So prevention. So all this I mentioned earlier, the slide can be available. You can go through it. It causes cancer. Child meat. All these our meats we eat overeated meat. It's an established cause of cancer. It is carcinogenic. Best treatment for cancer, prevention. So that's the best treatment. So how can we prevent or treat cancer? Any form of disease can be managed through these major forms: primordial, primary, secondary, and tertiary. Primordial just means people drink alcohol, people smoke, people abuse drugs. Why can't the government legislate it that all these things should be banned? By doing that, we are preventing cancer. That is the primordial stage. Then the primary is health promotion. This one we are doing now, that is the primary stage. That is the primary prevention. Like we talk about the possible causes, early presentation. So this is primary prevention of carcinoma. Then secondary is screening, case finding, prompt treatment. If you go for mammogram, in cervical cancer, there is this thing they do for women above 40, 50. They call that one pap smear. Any woman above 40 is good. Just go to the hospital. They will take a sample, take it to the lab. Once they find this virus, HPV virus, they know that okay, you are writing letter to cancer, bring it out. So this is secondary treatment. Like we are trying to make sure that through screening we identify it and we treat it. Secondary, that is secondary treatment. And early presentation. Tertiary treatment is when this disease has been established in the body and it has been causing harm already. In that regard, and that is the commonest cases we see in this country. Late presentation, and that's why when you get to cancer center, cancer treatment center, or the tertiary institutions where they handle cancer, there is very little or nothing a doctor can do. They just give palliatives just to suppress pain before the patient will die, eventually die. Cancer caution, change the bowel habits, a sore throat. I think I talked about this. This is a third slide. Proposed intervention. So what are the interventions you can do? Promotion of healthy lifestyle. You can reduce obesity by doing exercise. It's not necessary that we jog. In fact, jogging is it's no more encouraged these days. Brisk walking, you are not running, you are not walking slowly. Fast walking, if you can be doing it 30, 45 minutes, even in your compound every day, just be consistent with it. There will be improvements. Early detection, once it is detected, all these signs you mentioned, once you detect it, just present yourself straight in the hospital. That can give to you, that can add so many years to your life if allowed, instead of presenting later. Proper management. When there is cancer, you know to where to go. Don't go and use Cinnabar concoction. No, present in the hospital where you'll be treated. Then prevention of complications by presenting immediately after you see the symptoms. Complication will definitely not arise. Conclusion: if you are to avert the pending epidemic of non-communicable disease in Nigeria, all hands must be on deck. Individuals, what are the habits? What are the bad habits you are doing? Do you smoke? Do you take cigarettes? Do you eat all these processed foods, canned foods, all these preserved foods? These foods that they are preserving in canned. So all these things, they have carcinogens. Families, communities, partners, private sector, and all types of governments must play their role in preventing cancer. So this is the end of the slide. So you avoid cancers, have regular checkups.
Say that to Dr. Usman. May Allah subhanahu wa ta'ala bless him, and may Allah bless the knowledge he has passed to us. The time will never be enough, but what we are just trying to do is to sensitize ourselves. And inshallah ta'ala, by this third week of this month, inshallah, the third Sunday of next month also, he will be coming back here to repeat another serious ailment again and discuss it with us, inshallah ta'ala, before we now start moving from mosque to mosque to sensitize ourselves. So may Allah subhanahu wa ta'ala give us sound health and long life. So now we are going to open the floor for discussion, for question. So not to mix things up, if you have questions, we are going to take it the number once. So if you have questions, please. 1, okay. 2, 3, 4, 5, 6. Please, I want to recount it again because I'm not going to count our mind. So please, permit me to give you number 1, please, because it's actually in the point that I cannot see.
For this effort, really prevention and causes. And now is on you mentioned back pain, lower back pain as I mentioned that lower back pain is like also a sign of cancer. And I know those of us that are above 40 years, this is kind of lower back pain. Is that cancer also?
Number 2. Number 2 is okay. Please let us know. Okay. Okay, so now number 1 now. Number 1. So number 1.
Assalamu we are really grateful for this lecture delivery. We are very increasing knowledge. My question is based on your presentation. the symptoms of cancer, you made mention of weight loss. And somebody who engages himself in physical fitness must lose weight. So I get confused. I need to be expatiated on this. So,
Number 6. Assalamu alaikum warahmatullahi wabarakatuh. I was watching to see somebody that was that is die as a result of prostate. So I want to ask the question, and I asked the question. They said excessive as in regular sex protects somebody of having a prostate cancer. I don't know how it is. Number 2 is I was told that if somebody is becoming old and not 40, these 2 eggs, that the 2 eggs between the testes that become bigger, that by so doing it will block the urethra. So I don't know if there is any medication that somebody can use to protect that from enlarging, more than necessary.
Assalamu alaikum warahmatullahi wabarakatuh. My question was, from the presentation, it shows that radiation is also a risk factor to cancer. And we also know that microwave is also a form of radiation. As for those of us that has a microwave at home, which other will you give us as how to use it, or should we get it off?
Thanks for the presentation. My question goes down for the sister section. The majority of the question we answered already. Now you said if they have lumps in their breast, how do they feed that babies for those that give birth? And you said that majority of them 40 years and above do have that for delay of marriage. So some of them do give birth and do have that problem. So is it that when they give birth, then they have that breast cancer issue? How do they feed the baby? Is it that the cancer through it's being like transmitted also to the baby too? Please can you try to elaborate on that too?
So my question is this, why during the presentation you mentioned that if someone is like often frequency every and then a big sign of symptoms of cancer. But also also learned about what happened that once you pass what happened like water therapy, likely going to reduce certain diseases. And when you pass water therapy, it tends to be often more. That is important to play your system. So, perhaps if someone is passing water therapy, and the person is practically of water and pitching, and that tends going to the toilet, every and then. One person be confused like the person by doing often have cancer. And one person is going to the wound of the unit of because passing water therapy. So, how to tell that?
Okay, please, I will have my own question too. Regarding our children, cancer also affects children. And you told us that we should not take more of this processed food. You won't mention canned food. What of all these sugar things like biscuits or the fast food like Indomie? And some of them also develop some habits, eating raw Indomie. You understand? So it's becoming an habit in our children now. So will this also lead to cancer and possibly death also?
During the course of the lecture, meditation of particular people who in stage when the teacher on the previous so decided and when not to
Someone can talk about the lower back pain in prostate CA. I will just say that lower back pain is a symptoms of prostate CA, but then it won't be the ordinary symptoms. It will be combination of this lower back pain and the urinary symptoms I mentioned. Yes. Then, if you have lower back pain and you take an analgesic, it resolves. It is not most, it is most likely not prostate CA. So the CA that the lower back pain that is caused by prostate CA will be a very strong pain. And even in months, the patient just degenerates. But these symptoms will have been there before the back pain comes. Weight loss. Exercise with weight loss. Of course, I said unexplained weight loss. If we are doing exercise, of course, we will be using our weight scale to know if we are improving. So unexplained, like there is no reason for this weight loss. So there is reason for that one. Then regular sex with prostate CA. Regular sex has nothing to do with prostate CA. That's nothing to do. That's not. There is no text that says that if you have regular sex, you won't have prostate CA. So testes block the urethra. Testes cannot affect our urine output. Well, anyway, even when we grow old, the testes will not get bigger. It will even continue to be shrinking. It will get bigger. So at that age of 40, 50, the testes will be reducing in size. So it will get bigger. That's number one. Then testes has nothing to do with where the urine comes out. You know where testes is? Two balls are down. So the only thing that compresses the urethra is the prostate. That prostate that I talked about. The microwave ovum as a cause of cancer. And yes, all these things causes cancer, but then we won't, I actually didn't have enough time to talk to us. We won't stop using them. We have people that work in telecommunication companies, we have people that work in X-ray. We won't tell them to leave it, but they should wear their protectives. And the way microwave is designed, I don't think we are that exposed to it. The exposure is not that much, and close it. Lumps, how to feed the baby. In fact, I managed a patient last week on this. I actually sent the patient to do a mammogram for investigation. She's even breastfeeding. So on examination, I felt that there is a very big lump, very unfortunate. Just this last week here in Delta State. So this one, once it has been established that the woman has cancer, you stop breastfeeding the baby. Stop the breastfeeding straight. Stop the breastfeeding. So we can put the baby on all these formula feeds and lights. So cancer is an indication to stop breastfeeding. Then the lungs, talk about the lungs. Okay, I've answered the question. Okay. Frequent urination with water therapy. Of course, you don't drink enough water. You should urinate now. So if you are urinating frequently without the cause, in that regard, you know the cause that the water you think you took that is causing the frequent urination. But if you, in fact, even in UTI, urinary tract infection, you will be urinating frequently. But you combine all these symptoms together. Okay, basically to differentiate between UTI and cancer and cancer of the urination. In UTI, you will be having dysuria, difficulty in passing this urine, then you will be having lower abdominal pain. So those three things, lower abdominal pain, painful urination, and frequent urinations, that are the major things in urinary tract infection. So if you're having any of these, if you're having frequent urination without these two, and you're having other symptoms of terminal dribbling, still having the urge that you have still feeling the urine after you finished urinating. So then the sugary indomie or all these things, they cause cancer. I actually didn't have enough time to talk about this. All these indomie, all these sugary things, the charred meats. You talk about something burger. You go to all these fish they choose. So all these things, they have carcinogens. Yes, they have been proven. They have carcinogens that have been proved to cause cancer. So it is better if you can avoid it. It is better if you can avoid it. Because by the time this thing will cause problem.
May Allah subhanahu wa ta'ala bless our doctor and give him and all of us on the microwave. Can you come forward?
Okay. I said direct.
I know I made you said
Okay. Yes.
of course, I know a country that stopped the importation of microwave
Because of
the source is likely to cause cancer. Now, and I also understand that when you are using microwave, of course, you don't let the food be exposed inside the microwave. And again, I also know there are safe packs that is defined for microwave use. The safer for microwave. So I think because of the threat of cancer, all these measures were so I don't know. When you said we should not leave it, because you didn't look at it.
I just talked about it now. There's not a lot of it.
So inshallah ta'ala, the slides will be made available on our Akana platform of WhatsApp. And the lecture also is being captured through recordings. All things being for. We have the record, we are going to post link for us to watch and also send people to benefit them, especially our women also. I will only have asked about our website.